Did you know that BioPed Footcare offers complimentary diabetes risk assessments at all of our clinics? This is great, but what exactly is a diabetes risk assessment? How long does it take? And what exactly happens during the assessment? Well, today we'll be answering all of those questions. Diabetes can lead to a loss of feeling in the feet. This results in impacted nerve endings becoming less responsive to temperature, sensation, and even pain. Without proper nerve function, cuts and wounds can go unnoticed and lead to infection. Untreated infections can sometimes even lead to limb amputation, if severe enough. Don't let this scare you, because 9 times out of 10, amputations can be avoided just by regularly visiting your team of foot care specialists at BioPed. The Diabetes Risk Assessment only takes 60 seconds of your time. Crazy, right? Just 1 minute of your time can make a lifetime of difference to your health. Now you may be wondering, how can we determine so much information about your foot health in just 60 seconds? Well, let's break it down to a simple step-by-step process as to what you can expect. First, we will assess the pulse in your feet. This is done to ensure that there is a proper and unobstructed amount of blood flow reaching the feet. Next, we will look at the skin and nails to make sure there are no risk factors for wounds and that your feet are infection-free. This is a crucial step because if there is any risk for a wound, we need to treat them as soon as possible. After the skin and nails are assessed, we will then test the big toe joint range of motion along with identifying any foot deformities. Lastly, we will test the nerves in your feet using a monofilament. This is basically a plastic wire that bends when it hits your foot at 10 grams of pressure. It is done to test a nerve sensation in certain areas of the feet. It is an important test because this will assess if there is any nerve damage or if it is likely to develop in the future. The foot care specialist may also ask you a variety of questions throughout your assessment to help gather more information regarding your past and current foot health. After performing all these steps, it is important to document the results to have as a benchmark for future assessments. We also send the results to your doctor and provide you recommendations for how often you should be returning and how to better care for your feet. We hope you found this demonstration useful. At BioPed Footcare, we recognize how important diabetic foot care is, which is why we encourage you to come by whenever possible so that we can be with you every step of the way. To find your nearest clinic and to schedule your complimentary diabetes risk assessment, visit www.bioped.com/locations. Where will your feet take you? Do more with BioPed Footcare.